Let's go.
Okay, hi guys, my name is Ashley and I'm going to talk about my passion today, and that's career technical education medical assisting. A lot of you have probably heard of CTE, or as some people call it, ROP. It's a program where you get to get a head start on your career and learn many different things. There's a dental one, there's a vet one, there's fire science, there's agriculture. So there's a lot of different ones depending on what you want to major in or work in one day. And if you go to menu, and then go to videos, and then scroll down to the last one. Here's my ad, this one. Career technical education. Are you interested in a career in the medical field? Consider enrolling in CTE Medical Assisting. You will learn important medical skills like taking vitals, drawing blood, and how to give injections. That's a video of me drawing blood, or a picture, sorry. And then a video of me. Join the CTE Works class of medical assisting. So that's just a little bit of what I do and what I learn in class. Overall, like, my essential question was why high school students should join CTE and how it can prepare them for the future. So a great thing about CTE is that, especially mine, medical assisting, you can earn your MA certificate after the program is over, which allows you to save a lot of money if you wanted to go to MA school after high school, because I'm doing it for free. And this program, a lot of people in my class and other classes I know aren't ready for college, don't want to go to college, their family can't afford college, so they're doing this program so they can start working straight out of high school, and you earn not great money, but more money than minimum wage. And it's a great, like, program because you get to gain work experience, and having those, like, contacts and resources to go back and say, I worked here in high school and this is what I did. And it's just helpful being able to work for like in a medical field area. And it helps you prepare for the future, like, a lot. You learn, in my class I've learned like a ton of medical terms, which I'm later going on to Alabama to the nursing school, and I'm hoping that the terms I learned throughout this program will allow me to, like, succeed and, like, excel compared to other students and maybe get a head start just in case, like, the school's really hard or I'll already know some of the information. Also, I've learned, like, vital skills like how to draw blood, because you'll need to learn that in nursing school, and already have an idea and know how to do it, and how to give injections. We give subcutaneous, intradermal, and we give gluteal injections. And then also doing vitals is, like, the most important thing, just getting the blood pressure, pulse, oxygen level, and all that stuff, which I'll show you guys later. So lastly, I'm going to talk about my CTE specifically. My CTE is medical assisting. I applied to enroll in the program last year. I started in August, and I only come to school for 2 periods, and then I go to Oakmont. So at the beginning of the year, I was at Oakmont 3 days a week for 3 hours, and then 2 days online. And I did that while I was learning all different types of information to then prepare me to go to externship where I am now. But my teacher taught us, obviously, all the things we need to know before going out and working in the medical field. One of her biggest things that she taught us is professionalism, because we'd be working in an area where we'd be working with people that were a lot older than us. So we wanted to make sure that we were mature, and a lot of us are 16, 17, 18, and the people we're working with are in their 20s, late 20s. So we wanted to make sure that we were, like, up to their level and being able to communicate well with them and ask questions when we didn't know what was going on. And working in the medical field's obviously, like, there's a lot of guidelines you have to follow, and HIPAA is a insurance policy kind of where you have like accountability acts where if you have patient's information, you can't go and talk about it because it's their information. So a lot of stuff like that we learned. And so in early November, our teacher decided that we were ready, and I was the first of like 4 students to be sent out and get interviewed. I got sent to Med 7 Urgent Care in Carmichael, where I'm currently working. I started the week after Thanksgiving, and I work there 3 days a week for 4 hours. I have to work 12 hours a week and a total of 560 hours by the end of my time to get my MA certificate. While working at Med 7, I do a lot of different things. I room patients, I do strep test, urine analysis, urine cultures, which is if somebody has an STD or a really bad UTI, we fill a tube with their urine and send it out to a lab to get tested. We do pregnancy tests, flu tests, stitches. I've actually gotten to assist on stitches. I clean the wound before and after we do the stitches. I help the doctor or the PA fill the syringe with lidocaine, which is the numbing stuff that you put in the ankle or wherever we were doing it. And then I'll watch her do the stitches, and then I'll re-clean it and bandage it up. And that's my favorite thing to do. But also we have an x-ray tech, and we have a lot of broken bones, and we put braces on them. Like, I had never done it, and somebody broke their collarbone, and then they sent me into a room and was like, go put a sling on this guy. And I was like, okay, like, I don't know how to do that. And they're like, it's pretty self-explanatory. So I walked in and tried to put the sling on him, but he was kind of in pain, but it's okay. We do EKGs, blood draws. One thing that I've actually noticed, which is kind of sad in our community, is we test people for HIV around 3 times a day. I don't know how often those people are positives, but HIV is very prevalent in this area apparently. And that it's weird because if somebody gets tested for HIV, whether their test comes out positive or negative, they have to come back into the office to receive it. Since it's such like a big deal, they want to tell them in person that it's positive or negative. And then, so now I'm going to show you what I do on a daily basis by grooming a patient. So I'm going to have someone come up and do their vitals. Anyone? Maddie?
Can you turn the other light on, please?
You can sit here.
My vitals, but it just won't show.
Oh, I forgot to put this down. Okay, so when I am rooming a patient, I'll go into the waiting room and I'll call their first and last name. So I'd be like, Maddie Fitch, come on back. I'd bring her back, I'd take her weight, and we have a scale in the hallway, and then I take her into one of our 6 rooms. Room 2 is specifically for eyes, room 4 is specifically for ears, and room 6 is specifically for like women for pregnancies or UTIs or vaginal problems. I don't really know. Yeah. But okay, so I'm starting. I always have to write my name on all the charts I do, so then if I mess up, they know who to talk to, the time that I do it at, and what room I'm in. Okay, so as I come on back, hi Maddie, how are you doing today?
Good, how are you?
Okay, so why are you here today?
I've had like a sore throat for like 2 weeks now.
Okay. Sore throat, 2 weeks. And is your pain constant, worse at times, or does it come and go?
It's pretty constant.
Constant. Okay, and on a scale of 0 to 10, how severe is your pain?
6 or 7.
6 or 7, okay. And do you have any chronic or inactive conditions?
No.
No? Okay. Are you on any current medications?
No.
No. Have you had any surgeries in the past?
No.
No. Does your family have any history of chronic illnesses? Heart heart disease, hypertension, diabetes, anything like that?
Hypertension.
No? Okay, and do you use tobacco or nicotine? No. Do you drink alcohol?
No.
Do you use illicit drugs?
Yeah.
Okay, and how tall are you about? 5'7"? How much do you weigh?
130.
And are you allergic to any medications? So when we're writing about the medications, we write no known allergies, because obviously everyone hasn't tried every medication, so you never know if you are allergic to a medication. No known drug allergies. Okay, so I'm gonna start by taking your vitals. This is a pulse ox monitor, so I'm gonna put this on her finger, and it'll tell me her pulse and her oxygen level. And then this is a thermometer. It's for the temple. Temperature is 99. It's kinda high. Okay,
You acting sick, you just don't know it yet.
her oxygen level is 99 and her pulse ox is 66, which is pretty normal. For oxygen level, you want to be between 97 and 99. Anything lower, we're worried about fluid buildup in the lungs because that could mean pneumonia or something bad. And then the pulse, pretty average. Most people are between like 55 and 75, but it just depends on the day, if you've had caffeine or anything that would raise your pulse. Next, I'll take her blood pressure. Blood pressure, Blood pressure is usually 120/80. The top number is the systolic number, and the bottom number is the diastolic number. I'm just gonna put this on your
What
arm.
does that mean?
It's the numbers that are talking.
Stalwart.
Thank you.
Okay, so the top number is the first heartbeat you hear while you're taking her after like pumping it up, and the diastolic number is the last one you hear. So it just shows the.
Why would you do that? Is it really? Just talk. Wow. I've never used one for heart. I've always wanted to. For your heart? I've never used it for kids. You just told me to kill him. Did you hear that? That's okay. Get over it.
Yeah, so I got 118/72, which is like pretty normal. And a lot of people, when we have like DOT physicals, which is Department of Transportation, a lot of those people have really high blood pressure, and we actually have to wait, because if they're over 140 for the systolic number, they don't get cleared. So we need to, usually we like, if they have a high one, we'll turn off the lights, turn off the music in the room, close the door, leave them in there for 15 minutes, make them lay on the bed, and then we'll go back in and retake their blood pressure. And then lastly, we do respiratory, so how many times you're breathing in a minute. Usually, like when I'm taking her blood pressure, I'll do it. It's usually between 12 and 16. I'd say hers is 14 right now. And then lastly, I'm gonna ask a few more questions. Do you have swollen lymph nodes, you think? No? Hoarseness? Yeah. What about difficulty swallowing? Yeah. Okay, so one of the main things that the doctor wants us to do when they have a sore throat is they'll end up wanting us to give them a strep test, because then the doctor will know what he should prescribe them and all that stuff. So I'm gonna show you how we do a strep test.
I'm sorry, Maddie.
Yeah.
We always wear gloves, and then this is gonna take a minute to put on. That's too small. So after we do the strep test, we just start swabbing the back of the throat. We take it back into the lab in the back. We put 4 drops of 2 different reactions, and then we swirl the Q-tip thing in the tube for 10 seconds, and then we leave it in for 30 seconds, and we pull it out. And then we put a little test strip in it, and we let it sit for 5 minutes. If it's positive, I'll have 2 red lines. If it's negative, I'll have 1. So I'll show you how I'll do it. So I'm gonna have you stick out your tongue. I'm gonna press your tongue down. I'm gonna swab the back of your throat, okay? There you go. And then we just set it right back in here. And then I take it back and test it. And also, after I do that, I'd fill out, so these are our main forms, which is like why she's here. And then here, I'd put that I did rapid strep test. I'd write negative or positive, and then I'd write my name. And then once the doctor goes in, he'll write his notes, his diagnosis, and let's say he diagnosed her with some medications or whatever she needed, if she was positive or even negative, then he'd give it back to me, and I'd actually call the pharmacy that she'd want and prescribe the meds that she needs. Go ahead and sit down. So overall, I'm very thankful for my CTE experience. I've loved it a lot. I've learned so much, and now I know that I was doing the program to like make sure I wasn't going to Alabama to spend thousands of dollars on something I didn't even want to do. But I definitely like want to pursue this career later in life. And now that I've been like working in the medical field, I'm not even sure if I just want to be a nurse. I'd also be interested in getting my PA, which is a physician's assistant, and or nurse practitioner, or anything. It just depends how long I want to go to school. So yeah, that's it.
Good job.